All right, hey, Dr. Gardner here, going to talk to you about a patient today. I think people understand things sometimes better when we kind of show you an example of a patient. So I've got a patient that came in, a very interesting patient, and this is several years ago. She actually came in using a cane because she was having difficulty walking. She was an older lady, a little bit overweight, and she had significant edema and swelling from the knee to the ankle. In fact, it was the swelling kind of bulges over onto her ankle. So she had redness, she had just tenderness. Because the swelling was so bad, it acts like ankle weights, and she actually was having difficulty ambulating, and that's why she was using the cane. So anyway, we got her in, we did an evaluation, which is a physical exam and a complete ultrasound exam. On the ultrasound exam, it showed that her arteries were fine, her deep veins were fine, but her superficial veins, meaning the great and small saphenous veins, were incompetent, meaning the veins were not doing their job. The blood was actually going back down the leg towards the feet. That's what was causing, or one of the primary causes of her swelling. So, with a big, swollen, angry leg like that, we don't want to just jump in and operate. She had been in and out of compression in the past, hadn't really been successful because it hadn't been done correctly. So what we did is we had John see her. We had him get her swelling under control. And we're going to show you pictures of her before and after. In fact, here's a picture of what she looked like when she first came in the office. Take a look at this. Now, that picture demonstrates how bad her legs look. Now I'm going to show you pictures of what she looks like after we've gotten her swelling under control. So you see before, you see after, significant improvement. The volume reduction in this patient was tremendous, to the point where she no longer needs a cane to walk because she's not wearing ankle weights anymore. So it's really important to decompress and get the volume out of these legs. And again, diuretics is what we see commonly prescribed by a lot of primary providers. Unfortunately, it just makes you go to the bathroom a lot, and it really doesn't help the swelling. So no water pills. Now again, I'm not saying if you have a heart condition you may need a water pill, so don't just stop your water pill because you're watching this video. Always check with your regular doctor before you make any changes in medication. Having said that, a lot of times we are able to transition people off of diuretics, but this is a great example. We got the volume down, and now I'm going to show you a picture of what she looks like every day wearing her Velcro devices. There are multiple options when it comes to compression. Velcro devices are a great option for patients that have difficulty bending over. Sometimes this can be from chronic back pain, other medical conditions, weight, etc. The other thing that it helps with are people that don't have very good hand strength. If you've lost hand strength because of an arthritic condition or age or whatever, and you can't really pull hose on, then Velcroing back and forth is usually a good option. Plus, if somebody has a caregiver, putting a Velcro device on is much easier than trying to wrestle especially a class 2 compression hose on. So anyway, you can see her after pictures where she's got the Velcro device on. This maintains her swelling. Unfortunately, in this situation, her swelling has been there so long that she has a secondary lymphedema. She had a primary vein problem that led to chronic swelling, and when that happens, you get something called phlebolymphedema. Phlebolymphedema means that it's lymphedema secondary to a primary vein problem. So the swelling was there, it was chronic, the lymphatics end up becoming damaged, and now you've got a chronic swollen leg. So we get the fluid out, we maintain them in a Velcro device, and if she doesn't wear this, her leg will swell back up. So that's why I tell people this is going to be a commitment lifelong. But it's such a transforming thing for them to go from using a cane to walk to using nothing. So anyway, once we got her compression figured out and her swelling down and got all this fluid out of her legs, and we're able to get to what I call a maintenance phase, where now she no longer has the swelling, we're maintaining with her Velcro devices. We then treated her incompetent veins. The patient, when I talked to her about this, I said, hey, honestly, let's talk, and I do this with everybody, want to know how much improvement you got after treatment of your vein problem once we got the swelling under control. 20 to 30% improvement of her chronic swelling from treating the veins. So it really does make a difference, because remember, the vein problem is what started this whole issue with her chronic swelling. So we treated the veins, 20 to 30% further improvement in her chronic swelling, and now she's doing great. You know, she's up, she's back, she's walking every day, she's enjoying life, and that's our goal, is to get you back to a functional state and improve your activities of daily living, your ADLs, and your overall quality of life. So anyway, if you have questions, please let us know. Again, sometimes this is a multimodal therapy where we see you, we evaluate you, we figure out why you're swelling, and then we get the swelling controlled, then we come back, and if you have a primary vein problem, we'll treat it. Some people actually have swelling but no vein problem, and that's okay too. Those are just patients that have chronic edema, or what we call lymphedema, and we treat those patients as well. So if you have any of these issues, or if you have a loved one that has these issues, just let us know, and we are happy to help any way we can. So thanks for watching, and follow us on YouTube.